I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Today, we're going to continue our series on the 7 deadly sins of nutrition. And if you're new to the show, years ago, I put together the 7 deadly sins of nutrition, the 7 foods you want to cut back or cut out of your diet. Because I was talking about nutrition for years. I was trying to get people to make it, I tried to make it as simple as possible so people could follow what to do. So I said, I narrowed it down to 7. And those 7 foods are alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, most of you are saying, but Dr. Joe, that's my whole diet. If I can't eat alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, there's absolutely nothing I will eat, and I will starve to death. Well, here's the thing, that won't happen. There's about 120,000 good foods that you can eat, and there's only 7 you have to not eat. So I always say, listen, if I gave you $120,000 and I said, give me 7 back, no strings attached, would you do it? Of course you would. So I'm going to give you 120,000 foods. I want you to give me 7 back. And today we're going to talk about soda. So let's start with some facts about soda that you're going to find totally disturbing. Now, whether you're a former soda addict or not, you're probably aware that it's not good for you. It's loaded with added sugars, caramel colors, other additives. That's a lot more, there's a lot more to the syrupy sweet soft drink than what's listed on the nutrition labels. We just say what's in there, but the nutrition labels don't say what exactly is happening when you drink these sodas. Now, we're going to talk about regular than diet. Then we're going to go a little bit more into diet soda because it's actually worse than regular soda. Number 1, a lot of sodas have toxic chemicals. One chemical that's formed is called 4-MEI. Now, it's formed when making artificial caramel color that's found in a lot of sodas. Now, if you drink cola soda, you're used to it being what color? Brown. Well, the reason it's brown is because they add caramel color to it. Now, the only thing caramel color does is add color. Doesn't do anything for it, but it does have some negative side effects. A 2014 study from Consumer Reports and John Hopkins Center for a Livable Future, they discovered that 4-MEI can be found in varying levels in sampling of 110 different soft drinks and Diet Colas. Ingesting this toxic chemical could increase your risk of developing cancers, said the research team. Although the Food and Drug Administration say it's safe, it's not dangerous to consume this food or beverages with 4-MEI in them, as you'd have to drink like 1,000 cans of soda a day to experience any health concerns. Now, this worries me because if you're old enough to know what goes on in the world, we say many things are safe. I remember my mother telling me that when she was pregnant with me, the doctor said, you should smoke cigarettes because it's very relaxing and it'll help calm you down. Well, guess what? That didn't turn out so well, did it? And we talked about artificial sweeteners being safe. We talked about glyphosate, which is a weed killer, and that's safe. And guess what? Now it's not. So we know that there can be damage from 4-MEI. Can be, okay? But you're knowingly ingesting this stuff. It's enough to tell you that you probably shouldn't be doing it. You should put that can of soda down. Because I predict, and Dr. Joe's been 100% right in his predictions, that we're going to find more problems with caramel color as time goes on. And here's the funny part. They tried launching colas a while ago that were clear. People didn't drink them. It affected nothing except the color. People said, oh, can't drink it. It's clear. My cola's got to be brown. How ridiculous, right? Okay, other things about sodas. It can lower your fertility capabilities. If you're planning on having kids anytime soon anyway, it would be prudent to put down a soda for a while. A study in 2018 published in the Journal of Epidemiology. Researchers surveyed nearly 5,000 couples and found that just one or more of the sugary drinks like soda every day by their man or a woman led to lower chance of getting pregnant. Now, I've been in practice 35 years. Patients come to me all the time with every possible condition known to man, and they assume that Dr. Joe knows everything. And in most cases, we give them good advice. Sometimes they even stump me. But years ago, I didn't see so many people not being able to make babies. And now it's become a cottage industry, making infertility and infertility clinics. And so it's amazing to me that something's changing, but nobody's talking about it. 20, 30 years ago, every now and then somebody couldn't get pregnant. I get that. But now in vitro fertilization is huge. And a lot of it has to do with our environment, I feel. Other things that soda can do, it may increase your risk of stroke. Avoiding a stroke is a goal for most of us, I would think. And one way you can do it is to give up your soda. A study published in the journal Stroke, that's the name of the journal, they studied 2,888 people over a 10-year span, and they monitored them for stroke and dementia. What they reported is that those who had at least one diet soda a day increased their risk of either ailment, stroke or dementia, by 3 times. Now, I'll play devil's advocate for you. If somebody's drinking soda, chances are they have other bad habits as well. You're probably not a raw food vegan eating a plant-based diet and drinking a lot of soda. But this is the one thing that they found across the study. Now, soda can bump up your bad cholesterol. Now, not long ago, if you go to our website, drjoe.com, we did a show on cholesterol. Now, if you're looking for a topic, if you have a health issue, go to our website, drjoe.com, and type in the topic. Now, think of different ways to say it. You might put in testosterone, men's health, prostate. If it doesn't come up one way, it should come up another way. And we did a show on cholesterol, and it blew most people's minds. I got so many calls from healthcare professionals, from the public, of course, you our listeners, and you were blown away with the information, the research that's out on cholesterol. You don't want to miss this because you may be thinking that it's bad and cholesterol really isn't all that bad. It's the type of cholesterol. I'm not going to give a whole show on cholesterol. I was going to go off on a tangent, but I shouldn't. But soda can increase your bad cholesterol, and that can clog up your blood vessels, which may be another reason to avoid soda. 2015 study from the American Journal of Clinical Nutrition has found that subjects consuming drinks with low, medium, and high amounts of high fructose corn syrup for just 2 weeks had increased levels of LDL, or what we call the bad cholesterols, and triglycerides circulating through their bloodstream. This shows a direct link between sugar in beverages and the risk factors that of developing cardiovascular disease. This whole show is going to be me saying this is what's so bad about soda and hoping that one of these things clicks in your head. And I've learned this. I've been a speaker now for 35 years, and I've been an educator. And I'll give these amazing presentations. I'll teach postgraduate. I'll teach doctors, lawyers, judges. Insurance companies hire me to talk about injury. And it amazes me that somebody will say, and Dr. Joe, you said a couple of weeks ago one little thing that changed my life. So I never know what's going to affect you and what's going to have an impact on you, but I want you to listen to everything. I promise you, somewhere today, you're going to say, oh my gosh, that's me. Now, it can make you dependent. You can get hooked on sugar. When you're stressed and tired, you tend to reach for what? Sugary, high-fat foods, which is why so many people go for a glass of soda. According to research of the Journal of Endocrinology and Metabolism, drinking sugar-laden beverages like soda can help relieve stress because it helps shut down or reduce your cortisol levels. And that's your stress hormone. Now, it has a rebound effect and causes problems later on, but momentarily, you feel better. And because of the emotional response that sugar gives you, it leads you to consume even more soda. Of course, you drink something, you get high from it, you feel good from it. What do you want to do? You want to do it again. So there's a lot of different reasons why you're getting high from soda. One of the reasons is it shuts down your cortisol level just short term. What you got to do is if you have high cortisol, which is your stress hormone produced by your adrenal glands, you want to find out why you have high cholesterol. Is it chemical stress? Is it physical stress? Is it emotional stress? Chemical stress is easy. That's what we talk about all the time. You can change your diet. And patients come to me all the time and they say, Dr. Joe, I don't know. Giving up soda? That sounds a little radical. How about cortisol speeding up the aging process? How about increasing risk of heart disease, stroke? How about open heart surgery? How about taking medications because your cholesterol is so high and your blood pressure spikes? That, to me, is radical. Giving up soda, not so radical. Now, the good news is this. There's now soda that's sweetened with stevia or Lohan. These are sweeteners that don't affect your body, and they don't have calories in them either. So you can get sodas now that are sweetened, let's say, with stevia. If you have to have your soda, this solves that problem. So other things regular soda can do. It can lead to diabetes. More than 100 million Americans live with diabetes or prediabetes, according to the Centers for Disease Control and Prevention. Drinking soda may be part of the reason the metabolism disease is so rampant. Now, according to a study published in Global Public Health, this links high fructose corn syrup, a form of sugar, often found in sodas, usually found in American sodas. Out of the 42-country study, those with the highest high fructose corn syrup consumption had an almost 2% increase in diabetes versus countries that don't use the ingredient. Now, here's the thing. Many countries don't allow you to sell high fructose corn syrup because it's made with genetically modified products like corn and beets. And so high fructose corn syrup is not allowed in a lot of countries. That's why if you go to, there's a museum, in fact, in Atlanta, dedicated to soda, one of the big soda companies. And it has soda from around the world. And it's always amazed me. Because you can go in there and try different sodas from around the world. Same brand, same cola brand, and it tastes different. You think, wait a minute, it's the same soda. No one ever questions why it tastes different. Well, it's the water they use, but oftentimes it's the sweetener that they use. They'll use sugar versus high fructose corn syrup. If you go to a Latin American grocery store, you're going to find a lot of the sodas that you drink are not sweetened with high fructose corn syrup. They're sweetened with sugar. Because studies have shown that certain demographics like sugar better than high fructose corn syrup, so they sell the sugar. If you try the two, you'll be amazed. There is a major difference in there. Now, I'm not saying drinking sugar is better than high fructose corn syrup. It's not as bad as high fructose corn syrup. So I'm not giving you permission to do it. I'm just saying the high fructose corn syrup is worse. Another thing that soda does, it creates belly fat. Every day, I get questions through our website, drjoe.com. People send me questions all the time. In fact, I answered like 8 of them before I even got on the air today. And Dr. Joe, how do I get rid of belly fat? Well, belly fat is fat, but it surrounds your belly, but it also affects your organs. So if you're concerned about getting rid of belly fat as you age, and we should because it does happen, then you might want to switch regular sodas and also stop diet sodas. Because diet soda, many people switch from diet soda thinking that the sugar-laden soft drinks are bad. But according to research from the Journal of the American Medical of Geriatrics, the study of almost 1,000 adults aged 65 and older found that daily diet soda slurpers, those folks that suck it down, have waist circumference almost 3 inches bigger than those who didn't drink diet beverage. Now, if you're overweight, and I used to be fat, I can say the F word, I used to be fat, and boy, I tell you what, 3 inches off your waist would make a big difference, wouldn't it? And here we are drinking diet soda, which I'm going to cover a little later if I have time, and how much better it is because it doesn't have sugar. It actually has its own negative side effects, and I believe is actually worse. Now, other things soda can do, it can increase your blood pressure. How many people have high blood pressure? Raise your hands. 1 in 3 of you listening have it. So drinking too much sugar of any kind, especially soda, it can increase your hypertension or high blood pressure, and it's one of the surest signs of a bigger issue of your cardiovascular system. High blood pressure is not a problem. High blood pressure is a symptom. Why you have high blood pressure is the problem. Now, I take that back. I mean, high blood pressure, of course, is an issue. But getting to the cause of the problem, I find, is more important than treating the symptoms. Treat the symptoms, but getting to the cause, then you don't have to treat the symptoms. We just did a show, I think it was last week, actually, on high blood pressure. So if you go to our website, drjoe.com, type in high blood pressure, I think it was even a 2-hour presentation we did on things that you can do for blood pressure. So listen to that. Chiropractic care, by the way, is one of them. 2012 study from the Journal of General Internal Medicine. They looked at 150,000 people, and it showed that drinking sugary beverages like soft drinks that contain high fructose corn syrup is linked to a greater incidence of high blood pressure. And there are many studies out there that people talk about salt being bad for high blood pressure. Sugar is also bad for high blood pressure. So you're on a low salt diet and you're drinking soda, which, by the way, has salt in it. And the reason, I digress for a second, the reason we put salt in sweet things is it causes the parotid glands or the salivary glands to release spit. And spit has something in it called salivary amylase. And salivary amylase breaks down sugar, makes things taste sweeter. So we add a little bit of salt to make things taste sweeter. Isn't that weird? Sugar can also erode your teeth enamel. I don't think you need me to tell you that. So that's a big issue. The most universal attribute is the jacked up teeth and rotten teeth that can come from sugar. Research published in the Academy of General Dentistry found that citric acid in soda, not just sugar, can work in a similar way, like we talked about eroding the enamel, and that can cause a lot of decay. So sugar, bad. I brush my teeth every night. I brush my teeth twice a day. I floss once a day, and I use like a water pick type thing in between the gums as well. And every time I go to the dentist, they go, oh my gosh, you have the gums of a 15-year-old. It's amazing. So you don't have to have bad gums if you take care of yourself. And using something like a little water pick takes, I think it's like 25 seconds. I timed it one day. Is all it takes. So and you use some warm water. It feels good on your teeth. It helps relax you. Helps you go to sleep better. So there's another trick right there you can use. Sugar is high in calories. You already know that the weight gain starts by consuming more calories than you burn. If you're trying to lose weight, drinking a can of soda every day isn't your best choice. A 12-ounce can of cola, for example, has 140 calories and 39 grams of added sugar. That's how much sugar you should eat in an entire day. So if you drink a can of soda, that's it. You can't eat anything else for the rest of the day. Now, sugar can also make you age faster. This is one that always gets people's attention. All of us want to look younger. We want to have vibrance. We want to have that youthful glow about us. Well, when you eat sugar, it not only affects your health, but also affects your appearance. Studies have shown that a diet high in sugar can be to blame for breakouts, wrinkles, and other signs of aging. What happens is the sugar binds to certain proteins and creates something called advanced glycated end products. If you take the first letter of each of those words, AGES, it ages you. Advanced glycated end products. And what they do is it binds to the connective tissue, like the connective tissue in your skin, and it causes the connective tissue to become weak. Now, as a chiropractor and an orthopedist and a pain management expert, nutritional expert, patients come to our offices every day with pain, neck pain, back pain, shoulder pain, numbness, degeneration, arthritis. We've done shows on this. It's all on the website, drjoe.com. And they come to us and they say, Dr. Joe, you're my last hope. Dr. Joe, I have neck pain. I have back pain. I have degeneration of my discs. I have headaches. What can be done? And I say, 3 things have to be done to get you well. Number 1, we got to fix the spine and the joints. If a bone is out of place, it can pinch nerves and that causes pain, but the joints can also wear out. And that's when a connective tissue, remember AGEs, Advanced Glycated End Product, eat away at the connective tissue. So if you have bones out of place, mechanically they're rubbing against each other, but chemically we could be attacking the connective tissue as well. If you have poor digestion, if you have acid reflux, heartburn, burping, gas, bloating, the stomach may be misaligned or pushed up against your diaphragm. And my doctors, I've trained them all to pull the stomach down away from the diaphragm, physically releasing the stress on the stomach. Works extremely well. And I've done many, many shows on the dangers of the stomach up against the diaphragm. And then we got to get your diet straight. Again, we're putting together a healthcare plan, nervous system, digestive system, and nutrition. So you got to get the diet straight. And people come to me every single day. My team of doctors and I, we have a dietitian on staff and everything. And people come to us and say, Dr. Joe, oh my gosh, I got to lose weight. I got to get my blood pressure down. I got my cholesterol down. I have no sex drive. I have no sex function. I'm getting brain fog. My brain hurts. It sounds like a Monty Python skit. My brain hurts. If you're old enough, you don't remember that. And what can I do? And then we start talking about diet. And boy, sometimes it's almost like I'm talking about religion to these people or politics. Oh, I'm not going to give up my sugar. Oh, no. Okay. What's your goal? My goal is to lose weight or have better brain function, have better love life, or not age as fast. I said, all right, well, we're going to have to work on this. And then we give them options. You can use things like stevia or Lohan, xylitol in small amounts. These are sweeteners, and that'll kind of get you over the hump in many cases. But if we get the diet right, that prevents the body from forming these advanced glycated end products that attack the body. And that's why I recommend foods that are high in antioxidants. Because the advanced glycated end products and free radicals can attack the tissue and eat away at it. And so from a structural standpoint, it can affect your joints and your pain. And so if you're one of our patients, we want to get you well and out of pain as fast as possible. Chiropractic is the most effective, least expensive treatment for pain. I mean, that's it. I don't know how to make that any simpler. Chiropractic, most effective, least expensive treatment for pain. Why wouldn't you do it? I don't understand it. I've spent 35 years asking myself that question literally every day. So if we can get the spine lined up and you get the best chiropractic care in the world, and I believe my doctors are some of the best in the world, we want you to help by getting your diet straightened out. And by cutting out the sugar, it prevents the body from producing so many advanced glycated end products, which then slows down the deterioration of the connective tissue, which then allows your body to heal. My heart breaks every day, multiple times a day, when I see patients who aren't willing to change their diet. When I see friends and family members not willing to give up their addictions, because it hurts me knowing that they're hurting themselves. And it really breaks my heart. And so it's not hard to do this, folks. It's really easy. So we're talking about soda today and things that sugar can do to you. We're talking soda, a regular end diet. Sugar can harm your kidneys. Your kidneys are important for filtering out toxins that accumulate in your body every day. But if you're drinking soda on a regular basis, the function of the kidneys can be compromised. According to a 2011 study from Harvard Medical School, they looked at the data on more than 3,000 women over the course of 11 years, and they found that a high salt and high sugar diet, which is usually associated with drinking sweetened beverages, and even diet sodas can lead to reduction in kidney function. And when I first started in practice, hardly ever, I can't think of ever, when patients came in and had kidney problems. Now, I see kidney failure patients 2-3 times a week. My kidneys are failing, what do I do? Many times it's from a high-protein diet. You got to cut out these high-protein diets, folks. You don't need that much protein. I did a show on this. It's on the website, drjoe.com. We're eating way too much protein in our society in many cases, and we're eating way too much sugar. And then that can affect the kidneys. The kidneys start to fail. You come to Dr. Joe and his team and say, Dr. Joe, I'm stuck. I don't know what to do. Doctor says I'm going to go on dialysis, and if I don't get a kidney transplant, it's probably going to kill me. Here's the thing. I've had patients come to me. I tell them what to do, and they won't do it. So then they say, well, I'm going to get a kidney transplant. It's pretty severe. Somebody's got to give up a kidney, and you got to get a kidney. And sometimes that transplant doesn't work, so a kidney was wasted. And they go back to their old lifestyle. They continue doing sugar. They continue doing high-protein diets. And guess what? That new kidney, it's going to shut down. I have a very dear friend of mine, one of my best friends in the world, who had a genetic kidney problem, and he got a kidney from an old girlfriend, actually. But now that kidney's starting to fail, too. And it hurts me when I see these things happening, knowing that we have the answers. In most cases, not every case, but in most cases, we have the answers, and nobody's doing it. And patients come to us every day, say, Dr. Joe, why didn't somebody tell me sooner? Why didn't somebody tell me that chiropractic is the most effective, least expensive treatment for back pain? Why didn't somebody tell me if you're in a car accident, the first place you should go, if it's not life-threatening, is to a chiropractor? Why didn't somebody tell me if I change my diet, I can add years to my life and prevent the aging process, slow down the aging process, and prevent a lot of these diseases that I now have and wish I would have done something about when I was a child or when I was younger? And the answer is, I don't know. Now you have this information. There's no reason not to do it. So if you want to make an appointment to come see us, you can go to my website, drjoe.com, drjoe.com. And in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge, and West Cobb. Now, if you out of town, because I know the show goes all over the world, we can always set up a phone consultation or a Skype consultation. But the minimum things you should be doing, minimum supplements every day, are Super Greens and Essential Source. And the reason I say that is many patients report when they take Super Greens and Essential Source, it helps curb their sugar cravings. Because what happens is your brain is getting all the nutrients that it needs, and it doesn't have to start craving other outside stimulus. So 2 supplements everybody should be taking, minimum supplements, Super Greens and Essential Source. They're on the website, drjoe.com. They're 2 powders. I mix them with some coconut milk, or almond milk, shake it up, and drink it at least once a day. It's amazing, and the research is on the website. You can read it. So we're talking about sugar today, and people, I'm giving you all the bad stuff, but I want to give you some good stuff. If you start eating a good diet, if you eat more fruits, vegetables, nuts, and seeds, if you do things like Super Greens, Essential Source, there's another supplement called Gymnema, Gymnema, and that helps stabilize your blood sugar. Cinnamon, just adding some cinnamon to your food, half a teaspoon a day. Cinnamon can help stabilize your blood sugar, and that can oftentimes help cut those sugar cravings. So I'm giving you all the bad news, but I want to throw in some good news too, that once you start doing it, it takes 3 days, by the way, about 3 days to get over your sugar addiction. First day stinks, second day's worse, third day goes, it's getting better. By the fourth day, you're like, I can do this. But here's the thing with sugar. As soon as you have some, you want more. I'm just like you. I've told this story before. I was in New York a while ago, and I love bagels. Who doesn't love bagels? And I had vegan bagels, and I said, I can't pass this up. Vegan bagel, vegan cream cheese. I was in heaven. So I had a bagel and cream cheese. It was so good. And about a half hour later, I'm thinking, you know what I'd like? I'd like another bagel. Because once you started putting that sugar in your body wants more. So it's like an alcoholic. You can't have one drink because you're off the wagon, you start drinking again. Same thing with sugar. You've got to get it out of your life. And the secret I use, and maybe you can use this too, is don't have sugar in the house. That's breads, cookies, cakes, donuts, pastas, because if it's in the house, chances are you're going to eat it. If you want to make an appointment, come see us. If you have neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. Do it right now. Go to our website, drjoe.com, drjoe.com. Call us if you have questions. We work with people with all insurances, car accidents, sports injuries. Folks, I'm Dr. Joe Esposito. Thanks for tuning in. We'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.